Hello, everybody. It's Dr. Jeni Thomas here, one of the Keep It Anchored co-founders. Happy Tuesday evening. Here to talk about hair loss and with our dear friend, Dr. Lindsay Zubritsky, who will be joining me any moment. So welcome to my living room. Happy to answer any questions that you have about hair loss, hair treatments, what it is that you might be seeing. And here we have Dr. Zubritsky is going to be joining me. Let's see. Hello.
Hi, how are you?
I'm great. It's so good to see you.
Good to see you as well.
Yes, so happy Tuesday evening.
Thank you. Thanks for doing this with me. I'm super excited to chat about hair loss, keeping the hair that you have. So, it's a really, really popular topic and question that I get as a practicing dermatologist and on social media.
I mean, knowing you've been with patients all day, you've probably been talking this topic all day long.
Yes, every single day. That's easily the top three of common issues that people come to see me for. Even though I
Mhm.
will say a lot of people don't know who to go to when they have hair loss. So, for anyone listening, if you have any hair problems, come and see a dermatologist.
Yes, absolutely. I think you're right. It can be so confusing.
Mhm.
One, to know when you've gone from, normal hair loss to excessive, what to do about it, especially in the early stages, and even as it progresses, what even options are available for people. So, what advice do you often give?
So when it comes to hair loss, this is extremely, extremely complicated. So first and foremost, I say when you start to notice any amount or sort of hair loss or breakage or anything, make an appointment to see your dermatologist because there are many reasons that you can have hair loss. And there's a lot of medical conditions, some complicated ones like autoimmune diseases like
Mhm.
lupus or dermatomyositis, but there's the more common ones like postpartum hair loss or age-related hair loss or androgenetic hair loss. And that is your typical ones that you think of that men get balding, but women also get it too. So when it comes to hair loss or you're starting to notice thinning of your hair, it's so important that you address it right away and you don't let it go.
Right. Agree. I mean, the whole idea of what is it? An ounce of prevention is worth a pound of cure.
For sure.
Yes. We see from a lot of the research that we've done with Keep It Anchored is that some of the earliest signs people notice is what's coming off their head versus how
Mhm.
what's on their head has changed. So if you're seeing more hair in your brush or in your drain, I mean, you know that normal amount. So when you
Mhm.
start to see it pick up, I think you're your own best judge of when those changes are happening. Then it might be time to do something to get ahead of it before you're trying to correct a problem later on.
Yeah, absolutely. I think it's so much easier to keep the hair that you already have instead of trying to, chase your tail and regrow hair. So
Mhm.
that's why, like you said, prevention is so key. The second you start to notice that you're losing your hair's falling out more, your hair is thinning, that you address it because we can help to stop it, slow it. But once you lose it, and if it becomes scarring, it's much more difficult and more expensive to grow hair.
That is true. Very true. So it looks like we have some questions that have come up. A great one. What do you consider as normal hair loss?
So most people lose anywhere between 50 to 100 strands of hair every day. So that's totally normal. We all should be shedding our hair because the way that hair works is the majority of hair is in this growth phase called anagen phase.
Mhm.
That is where our hair is growing. It's attached to our scalp. But there is, about a 10% of our hair that's in this phase called telogen phase. And telogen
Mhm.
is totally normal. That's when our hair is naturally coming out and it's allowing for a new hair to grow. So, like you said, when you start to notice more hair shedding, that's a sign that you could be experiencing something could be going on that you need to be seen for. Also, if you're starting to notice thinning of the hair, if you're starting to notice a widened part line or a
Mhm.
receding hairline, or even patches of hair loss, those are signs that you could be experiencing hair loss, hair thinning, or alopecia.
Yes, yes. We've seen some people are concerned about hair loss that happens from breakage. So let's say you're a color treater, you use, heat stylers quite
Mhm.
often. You might notice your ponytail is thinning, but it's thinning more towards the end versus up at the roots.
Mhm.
So in that case, great conditioning product can help to prevent that loss that comes from breakage.
Absolutely. I totally agree. And I really like the Keep It Anchored conditioner for this because it does help to prevent that hair breakage, which is an important part of keeping your hair healthy.
It really is. And the other thing that we've seen from our clinical study is the longer that your hair can stay anchored to the scalp, hence the name Keep It Anchored, the more hairs you keep on your head at any one time. And so I know you talked about the telogen phase. What we believe happens when you're exposed to oxidative stress, which I don't know how familiar people are with the idea of oxidative stress, getting quite technical here.
Mhm.
um, it can stress your scalp and cause your scalp to let go of your hair too soon. So
Mhm.
it doesn't stay in place throughout that whole telogen phase, which should last for months. And
Right.
so instead, you have more hair coming out that causes excessive shedding.
Mhm.
And that's what Keep It Anchored was designed to, help get ahead of and help
Mhm.
strengthen that anchor of the root to the scalp so that you reach your full potential of hair in that telogen phase, which means hair staying on your head until the very last moment.
So when it comes to hair loss, there's so much that's out of our control, right? So if you have a genetic predisposition to developing androgenetic alopecia or
Mhm.
age-related hair loss, or for, my postpartum moms, telogen effluvium, there's nothing you can do to stop that. But what you can do, which I think is so cool about this product, because there's nothing like this out there, it's going to help you keep the hair that you have. And it's going to give you control over a factor. Like I
Mhm.
said, you can't control your genetics. You can't control how your hormones are going to respond after having birth and going through telogen effluvium. But what you can control is the oxidative stress that your scalp is exposed to. And the oxidative stress, like you mentioned, that's going to weaken that hair's anchor to the scalp. And so by
Mhm.
reducing that and using products like Keep It Anchored with antioxidants and mineral zinc and B vitamins, that's going to reduce that oxidative stress in the scalp and help to anchor the hairs that you already have.
Mhm. Yeah, completely agree. And I mean, this is the time of year to be talking about it because,
Hmm.
like, for people who aren't familiar with oxidative stress, it can come from UV. So, I mean, I'm based in Cincinnati, Ohio. Gorgeous day, pure sun, wonderful day to be out. But hey, that's a lot of oxidative stress that,
Yeah.
we're
Well,
being exposed to.
right. UV rays, pollution. I mean,
Yeah.
every single day. It's just like our skin, right? We put antioxidants on our skin. So why wouldn't we do the same thing for our
Mhm.
hair health,
Yes. And that idea of having a healthy scalp being good for having your best hair, I mean, that idea makes so much sense. I think that it's so intuitive, but the data had really been lacking as to what exactly is linking those two together. And it seems that oxidative stress is, that key link there. And when that stress is there, from what we've seen in our clinical research, it can lead to that early and excessive hair loss, which is why we developed Keep It Anchored to be focused, as you said, Dr. Zubritsky, on antioxidant approaches to neutralize that oxidative stress or basically calm a stressed scalp
hmm
so that your hair can stay in place for longer.
Exactly, exactly. Yeah, so I really like the Daily Hair Essence. That's been my favorite. I don't know what your
Right here.
favorite is. Oh, there you go.
Yeah.
That's perfect. Yeah, so I started using this a few months ago. When I first met you, I had not ever heard of anything like this, and it's so nice to have another hair product in my repertoire to help with hair, to help improve hair and to help reduce daily hair loss, because I mean, this is just so common and people are experiencing it so much. And I really like using the essence because it's super easy to do. It like doesn't take any more time. I don't have to wash my hair more often because I'm a twice a week kind of person. I don't have the time to wash my hair every day. And so I like that I can use it when my hair is dry or when my hair is wet, and you don't have to rinse it out. It just takes, I think, like 8 to 10 drops I put in my scalp,
Hmm.
and that's it. I mean, it takes literally seconds to do every night. So it's not like this whole, the way that people do, a 10 step skincare regimen. And you don't have to do
Yeah.
that. You could just
No.
put a few drops in your scalp, go to bed. That's it.
Yeah. I'm glad you said easy because that was the original intent of how easy can we make this for people to be able to do everything they want to do with their hair, but also anchor it. So I'll show you what's in that. Our starter kit has the Keep It Anchored shampoo. And this shampoo does everything you would want your shampoo to do. It cleans your hair, it hydrates your hair, and then it also has this clinically proven technology to help keep your hair anchored.
Mhm.
And then, so on those wash days, you would wash with the shampoo, follow with the conditioner. And as you were saying, the conditioner was designed to help take out one of those other components, the hair loss that comes from breakage, by strengthening your hair against that damage and breakage. So you keep it strong along the links of your hair. And then the hair anchoring essence is really that key part of this. And it is something that you would be adding an additional step to your routine. But as you said, it's a very fast, easy process. I'll show you, in fact. Um, okay, so you have this tip that needs to go straight to the roots of your hair.
Mhm.
And you said you use 8 to 10 drops. You just drop it.
I mean,
Okay,
literally
sorry.
seconds. That's it.
Yeah,
That's it.
that's it. Massage it. That's it.
That's it. And you know what? Even for those who still think that that is too much of a step, like my husband, he's like, he would never, he doesn't even put sunscreen. I'm like, come on, it's not that hard. But he washes his hair, right? We all wash our
Yeah,
hair. So at the very least, I have him use the shampoo. And the shampoo has similar ingredients. It's just not as concentrated as that, but it still works and it doubles
yeah,
as a shampoo. So it's like you literally don't have to do anything
yeah,
differently for
yeah.
that.
And you don't have to change how often you wash your hair. So, like you said, you're a twice a week kind of person. And so, using the hair anchoring essence, you put it on wet hair, you put it on dry hair, it dries really quickly. And so, you don't have to change your wash frequency if you're not a daily washer. So, that was all very much in part of how we tried to put this kit together.
Hmm.
So it looks like we have a few more questions. Let's see. Um, how do we need SPF for our hair?
That is a
That's a really
great question. I love that question. Um, SPF, absolutely. So there's two ways to protect your scalp from UV rays. One is physical protection. So you can use
Mhm.
something like, wide brim hat or just or an umbrella to protect UV rays from hitting your scalp. Or of course, you can use SPF. So there are actually a few SPF sprays out there that are literally made for your part line. So they're not going to be
Mhm.
greasy, they're not going to be sticky, they're made just for that. And so that's
Yeah.
what I recommend to those who wear visors, or my ladies who don't want to, or men who don't want to mess their hair up and wear a hat. You just spray some of those SPF sunscreens in your hair and off you go.
Yeah. I think that is a big help for sure. And I think for the effects that UV can have on your hair color, it's helpful. You do need to, if you're going to use it across your head of hair, you
Mhm.
need to use quite a bit to really cover it.
Mhm.
From the scalp point of view, those SPF, they might help with the UV rays that are here. We also find that there are free radicals that end up really concentrating in the roots and the scalp environment. So
Mm-hmm.
it's good to have that dual defense if you're using SPF for your hair.
Mm-hmm.
Also use the antioxidants at your scalp to be able to get at, what oxidative stress might have been going on within your hair.
I mean, I said this already, but we all, if you ever talk to a dermatologist and they tell you about their skincare regimen, it includes pairing antioxidants with SPF. So that is like peanut butter and jelly to me. I put my
Mhm.
antioxidant on in the morning on my skin and I put my SPF on. So same deal goes for the scalp. I mean, the scalp is skin. So why would you protect it any differently?
Yes, great point. Okay, while we're talking about things that you can do to take care of your scalp, skin, and your hair, biotin. This is something that comes up quite a lot. What are your thoughts on, does your hair and your scalp need biotin to get ahead of hair loss?
So, of course, our body and our hair needs biotin, but the majority of people, and I'm saying 99.999% of people, get enough biotin in their
Mhm.
diet. So, taking more biotin does absolutely nothing. And that's why I think that biotin supplements are quite frankly a scam because unless you are biotin deficient, it's unfortunately not going to help you keep your hair or
Yeah,
grow your hair or prevent hair loss.
yeah.
So there are many more options out there with a lot of evidence to support it. I don't know where this myth of biotin and helping with hair regrowth started. I mean, I fell for it even before I was a dermatologist. So
Mhm.
I get it, and people are still shocked when I tell them it's not going to do much for you unless you're,
Yeah.
again, biotin deficient, which is extremely rare.
Mhm. I mean, it is pervasive, but same thing from all of the data that we've seen. We've yet to see data that taking biotin is going to be that silver bullet for hair
Hmm.
loss. Okay, let's see. Another question is, um, if you stop using hair loss products, do you lose everything you gained?
That's a great question, and I think it depends on what we're talking about. So, for example, minoxidil or Rogaine,
Mhm.
that's only unfortunately going to work for as long as you are using it. So, if you're using it for something like androgenetic alopecia, that is a genetic cause. There's nothing you can do to cure that. And so, all you can do is unfortunately pretty much put a band-aid on. But when
Mhm.
people hear that and they say, "Oh, I have to use that for the rest of my life," I say, "Well, you brush your teeth every single night. So it's the same
Sure.
deal. So if you want to, continue to keep your hair or to grow it, then that's what you're going to have to do. I mean, there are
Mhm.
a few things that I've seen that maintain it a little bit longer. So things like PRP, those are great options.
Yeah.
So yeah, hair loss is tricky. It's tough, but we have good options. No cure for most things, but we have good options.
Mhm. And the same with Keep It Anchored. This antioxidant approach is, it's not a cure. It's something that you have to, stick with on a daily basis. So we were talking
Yeah,
about the essence, this little guy that you need to use it daily because your head is being exposed to your
hmm,
scalp, your hair is being exposed to oxidative stress daily. So that's why it was so critical to have this
right.
daily essence as part of the kit because you're going to continue being exposed to it.
Yeah.
We do see with Keep It Anchored, if you've been using it for quite some time and you stop using it, your hair is going to go back to the excessive shedding that you had before. We don't have any reason to believe it's going to be a rash of hair just coming out in clumps afterwards, but it will
Right.
be that gradual ramp down as it was the gradual ramp up when you started using Keep It Anchored.
Right. I did see a few questions. I think that this would be interesting to answer exactly how this works.
Hmm.
So, it's not going to grow your hair, right? So it's not going to prolong the anagen phase. What it's going to do is it's going to keep it in that telogen phase and allow it to complete that telogen phase
Hmm.
cycle and prevent it from prematurely entering the exogen phase. And so by reducing oxidative stress in the scalp, the oxidative stress is what weakens that hair's anchor to the scalp, especially during the telogen phase. And so by reducing oxidative stress, that anchor to the scalp is going to be stronger, and you're going to keep that hair that you already have.
Yes, that's exactly right. Like when you think about the scalp surrounding the root of a hair follicle, when it's in healthy, when it's in great shape, good condition, it can really have that nice grip on it, and the attachment between the hair follicle, pretend this is a hair follicle, and the scalp, is nice and snug. But then as the scalp becomes stressed, that anchor, the fiber to the scalp, begins to weaken. The hold the scalp has on it lets go, and you lose it far sooner than you need to.
So as a dermatologist, I mean, I'm always skeptical of when people approach me about hair loss, these magic gummy bear pills. So I think that it's really important that we also bring up that there was a clinical study that was done that actually
Mhm.
showed that this works. So the gold standard for any sort of study to say if it worked or not is a double-blinded, placebo-controlled study, which was performed in this case. So they looked at, I think, 300 men and women, and they started from the beginning. They had those who used it and those who did not. And then at the end of the 6-month trial, I think it said there were 20, those who used Keep It Anchored had 2,400 more hairs than those who did not. So, I mean, the proof is in the pudding, right?
Yeah.
Evidence-based medicine is where it's at. So that's why I don't recommend biotin, because there's no studies to prove that it works. But I think this is super unique and a really cool approach to maintaining the hair you have.
Hmm. Yes. Great memory about the study. It is something that we took really seriously and went to great lengths, because there is so much out there that is not backed by science, or at
Mhm.
least rigorous science, to feel confident that what you're going to invest in, use on a daily basis, is really going to do something for you. So
Mhm.
that's why it was so important that we did the 6-month study. And a little known fact here, seasonal hair loss is a real thing. Like we
Mhm.
do lose more hair late summer, early fall, after all of the UV exposure that we go through in the summer. I'd say the exact mechanism is not 100% clear, um, but it is known you lose more hair after end of summer. And that's why we set that 6-month period to be able to capture what's happening through the seasons,
Mhm.
so that we could understand what effect it does have. And we saw by starting this clinical study in May, carrying it through, 6 months to the back half of the year, that whole seasonal hair loss phase was significantly lessened. So it's perfect timing for where we are now. Like start now and get
Mhm.
ahead on that seasonal hair loss that tends to ramp up around August, September.
Yeah. I
Yeah.
love that you did it starting in May, because there's so much oxidative stress in the air right now with all the UV that we're being exposed to in the summertime.
Yes, exactly. I mean, it's a great thing about summer solstice, so new, so recently happening. We have more sun, but we also have to take care of ourselves.
For sure, for sure.
Okay, here's a good one. We hear this quite often. How do you stop postpartum hair loss?
Well, unfortunately, there is no stopping it. It's going to happen. It's just a very common condition that
Mhm.
happens. So for those who don't know what that is, postpartum hair loss is also technically known as telogen effluvium. And so it also occurs after other things like an illness, a hospitalization, a new medication. So it's not specific to postpartum. It occurs about 3 months after giving birth, and it lasts about 6 to 9 months. And so this happens whenever what happens here is more of your hair enters the telogen cycle. And so that's why you start to notice more and more hair shedding. It's actually not hair loss. You notice more hair shedding, but that's just a little side. But what I think that a good question that I've seen come up here is, will this help with postpartum hair loss? So while it's not going to stop it, it's not going to prevent it, and it's not going to regrow your hair. It's great to utilize this, because what it's going to do is, as your hair is regrowing, which inevitably in the majority of postpartum telogen effluvium cases, it grows back on its own. You want to allow that hair to be in the healthiest environment as possible, because it's fresh new baby hair, and you want to keep that hair anchored. You don't want to lose that hair that you're growing back. And so I think that's where the Keep It Anchored fits in, and it's a really nice addition on to your already gentle hair care regimen to really help keep those brand new hairs that you're growing.
Yeah. And I know showers can be really rare in those those first few months of having a newborn. So if nothing else, use this essence as a
There you
way to
go.
get that dose and a quick refresh. Um,
Exactly.
yeah, so super easy to use. I mean, it's crazy. You go through those months where you feel like your hair is as full as ever, and then it can just come on a bit unexpectedly. A
Oh,
big
it's devastating. I went through it, and I'm still, I mean, my baby's like 14 months, and I'm still having these like little baby hairs. So thank God for Keep It Anchored to allow these hairs to continue to stay and not lose them.
Yes, yes. I'm glad it's been helpful for you. I know a few people, one of my co-founders has been through the exact same and has been using it all the way through. Um, let's see, what else do we have here? Um, so there's also a question about, this is a slightly different topic, but while we have you, what products do you recommend for blackheads?
Oh, great question. My favorite is going to be retinoids. So those are prescription medications. It's a vitamin A derivative. That's, the most amazing product you could use for blackheads, which are also called comedonal acne. I also like things like beta hydroxy acid, like salicylic acid, to help with that as well. So those are my two favorites.
Excellent. Excellent. So what are other common questions that you get asked about hair loss?
I guess the most common question is, how do you treat it? And I know I kind of already touched on that with the Rogaine or the minoxidil, but treatment wise, I think it depends on, first, if you're a male or female, and second, what type of hair loss or alopecia that you're
Mm-hmm.
experiencing. So I'll take the most common example is androgenetic alopecia. So things that work for that, you always want to target the hormones, because it's too much of the testosterone that's being converted to DHT, which is going to cause your hair to go away. And
Mm-hmm.
so that's how, Rogaine will help to increase the anagen phase. Things like finasteride, which is also called Propecia, that's what men take, and that's going to help. And off-label, I do prescribe that for women if they're postmenopausal.
Okay.
Things for women, I'll also prescribe something called spironolactone that also works hormonally to help. We have procedures in office called PRP, where we'll take platelet-rich plasma from the patient, spin it down, and inject it right into the scalp, and that helps to regrow hair as well. So while there's several options that work well, there's not a ton of things. So a lot of these things do need to be prescribed by a medical doctor. There
Yeah.
are a few supplements that I actually work. So they're called nutraceuticals, and they're specifically made and tested for hair loss. So you're typically not going to find this at your Walmart or anything like that. They're online, or they're sold in physician offices. But if you do want to talk about vitamins and supplements to see what works, if you do have a deficiency in something, say you're iron deficient or you're vitamin D deficient, and if you find that is the case through blood work, then it's reasonable to supplement with vitamin D or iron or whatever you need. And that has actually been shown to, if you're low in that and you replenish it, you can get some of your hair back.
Mm-hmm. That's a great point. That's another like controllable factor in
Mm-hmm.
this is nutritional sufficiency, and then the oxidative stress bit is something that you can have a hand in controlling to get rid of that excessive shedding.
Mm-hmm.
Um, yeah, so let's see, what else, what haven't we covered? We've talked about postpartum hair loss, the routine,
Hmm.
and we often get asked, what should I expect? What am I going to notice? Because I know as you talk about nutraceuticals, that can take several months. Same thing with minoxidil. You've got to wait for it to regrow. And so regrowth products are going to take some time before you see effects. We see with Keep It Anchored that within the first, maybe first week or so, people notice their scalp. If they had noticed it was feeling a bit irritated or dry, that they feel their scalp just feeling better or even not noticing at all, which is really a sign of a very healthy scalp.
Hmm.
And then within a couple of weeks, we hear from people that they start to notice less hair in the brush, see less hair in the drain. And so it's a gradual process, but you should have these signs along the way that it's beginning to work for you. But to get the full effect, I think, as you're saying with any one of these treatments, it just takes regular use. You just have to stick with it because there really is not a hair loss cure at this point.
Agree. And I think the most important thing people should take away from this is there, like you said, there's no magic cure and there's no instant fix. So anytime that
Mhm.
you have hair loss, it's going to take time to grow that hair back. I mean, you can't just grow hair overnight. So no matter what you do, and I find that people find it very frustrating that they don't see, they're putting all this work into it and they don't see improvement, in the first few weeks and they're doing all this work. And this is just generally speaking.
Yeah.
But it's so important. I mean, if you think about your hair growing from your scalp, I mean, to get hair this long, it's not going to happen in a month. I mean, this has taken years to get
Mhm.
my hair this long. And so when you're regrowing hair, you're trying to maintain your hair, it's going to take time. So, no, and if anyone tries to tell you different, be wary of that.
Yes. Yes, absolutely. So patience is a virtue,
Hmm.
prevention, all these sayings that apply to hair loss and approaches to to help keep your hair or to get it back once you've lost it and want to see what you can do to recover it. Okay, so Dr. Zubritsky, I think we've covered a range of topics linked to hair loss. Tuesday night, what better topic? I think we could go on and on and on. Thank you, everyone, for submitting your questions. And we really appreciate you joining and listening in. Dr. Zubritsky, thanks, big thanks to you too.
Absolutely. I had a blast. Anytime you want to talk hair, give me a call. I love it. I love it. And there's so many people who have so many questions on it. And, I really love helping people out and answering some of these misconceptions that surrounds hair loss. So anytime you
Mhm.
want to do it, give me a call. We could do it again.
Love it. I do have to say, hair loss is not a topic that people often feel comfortable talking about, but we all go through it to some extent or another. So I'm glad we have this conversation. We just encourage people to continue talking about it, to friends, know that you're not alone if you're experiencing it, to dermatologists too, if you feel like you really don't know what to do. And you can always reach out to Keep It Anchored and we can help get you to the right place. So thanks again, everybody.
Thank you, everyone, for tuning in. Thanks for having me.
Thanks. Have a good night.
Bye.
Bye.